Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you doing today?
I'm great. How are you doing?
I'm good. What do short-tempered doctors suffer from?
Short-tempered doctors suffer from not enough vitamin C.
No. They lose their patience.
Oh, that's a good one.
Well, Nita, you better get some callers in here. We're looking for you guys to call in to learn about how to heal your musculoskeletal pain. And we do it with regenerative medicine of platelets and stem cells. Easy peasy. Walk in, get injections, walk out, and hopefully heal up quick. The phone number to talk to me live right now, grab your pencils. If you're driving, pull off to the side of the road and call in. 866-870-5752. I want to repeat it a few times. 866-870-5752. One more time. I don't know why the studio doesn't get a better phone number. Do you, Nita? 866-870-5752. I'm serious. I mean, my number to my office is 800-300-9300. You'd think a big radio station like this could do better. Anyway, we're here to talk about today. Nita and I are here to talk about my new book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's about how not to have surgery when you don't need it. And I bless all the orthopedic surgeons in the world. I think they're amazing, and I think they're doing way too many surgeries. It's the culture that we live in today, especially in America, where surgery is the king. Medications and surgeries and things that I think are not good for people. So actually during my residency at UCLA, I started doing regenerative medicine. I was healed by it on my wrist, 50% overnight after a terrible golf injury where I hit the ground instead of the ball, and I had excruciating pain. And then also I was healed in my shoulder, which I injected myself, and overnight it was completely healed. I had had a shoulder surgery while I was in medical school, fourth year medical school, that really screwed me up. And I loved the surgeon. He was my boss. He was my professor. Not going to mention his name. He may not even be around anymore. I don't know. He was a great guy, and he was a very active athlete in his day, and I admired him quite a bit. And I actually asked him to do surgery on my shoulder because I didn't know better. I don't know if you know that story, Nita. I was in so much pain from weightlifting injury that when I was with him doing surgeries during a rotation in orthopedic surgery, I said, "Can you do my shoulder?" And he said, "Well, our schedule is really booked up." And I said, "Well, because of my schedule with medical school, I only have a break for the next 3 days." He goes, "Okay, I'll slip you in." And I was very excited to have my shoulder operated on because I thought that would fix it. And what happens, I wake up, my arm is swollen. I have these huge blisters. They were like an inch or two long. I don't know. I still don't know how that came from, where that came from, all filled with fluid. And I had a fever, and I was in miserable pain. And unfortunately, nobody knew what to do about it. I thought I had an infection, but there was no infection. And I just kind of toughed it out. And it finally, the swelling went down over a long period of time. About 4 years later, in my residency, I learned about regenerative medicine, and as an experiment, after my wrist healed so quickly, I personally injected my own shoulder one time, a lot of pokes, but one time, And I woke up the next morning completely pain-free with full range of motion. And at that point, I knew that I would be a regenerative medicine doc and I would not be doing surgery. And it totally changed my own healing, changed my own life. So if you have anything like that going on, if you've got neck pain, back pain, shoulder pain, elbow pain, wrist pain, arthritis, I do a lot of finger arthritis, a lot of knee arthritis, ankle arthritis. People come in ready to have a fusion. People come in all the time ready to have a surgery, joint replacement, you name it. And they tell me that they've got to do this, and I go, after an examination, I go, no, you don't. And unfortunately, I have a lot of people who come in after failed surgeries. I'm going to say from my experience, it's about a 50-50 wager. It's like going to Las Vegas. Get a surgery, maybe it'll come out better, maybe it'll come out worse. And a lot of them that come out better in the long run get worse because often tissue is being taken out that stabilizes the area. So you can tell, don't come to me if you want surgery. I'm the guy that doesn't like it. I haven't had good results on my body, and I see way too many people that have failures. So give me a call right now. Talk to me about your musculoskeletal issues, things that you've either had surgery on that have worked out great or didn't work out great. We want to learn from you. And the phone number to talk to me live right now, I'm going to say it slow, 866-870-5752. If you call, you're going to get a free copy of my book. I'm going to send it out for free, $25 book. It's about 200 pages long. It's got about 265 studies on why surgery is really not the best thing to do unless it's an emergency, and how regenerative medicine with PRP, platelet-rich plasma, or stem cells, or both, are really the best way to heal things unless there's an emergency. If you have a broken bone, what I do is not going to help you. But if you have a broken bone and you get it fixed surgically, very often the soft tissue around that fracture, which heals up, remains very painful, and I can help with that. So I take care of all kinds of injuries, all kinds of arthritis, everywhere from the top of the head to the bottom of the feet. Plantar fasciitis, that's a very common thing I see. I think the most common thing that I see are meniscal tears in the knee, rotator cuff tears in the shoulders, and neck pain and back pain. But there's no part of the body I don't inject. I often inject hamstring tears, and this is something to be very wary of. Just because a doctor says you have a tear, which he sees on an MRI, does not mean that that is the pain generator. The reason we know this is because when we do studies on people that have zero pain, we just want to see what's going on. We find all kinds of tears. We find herniated discs. We find arthritis, and these people say, well, I don't have pain, so get away from me. You know, you're not going to do surgery on something that looks like it's a problem, but doesn't bother me. So just because your doctor says your image shows something terrible does not mean that it's causing your pain. Very often I see people that come in with a meniscal tear. Actually, I just had one yesterday. It was a young man and a football player in high school, and he heard a pop when he was playing, and I looked with the ultrasound. I saw some fluid in there, and I said, if we aspirate that fluid and it's red, meaning it's blood, then what you experienced was probably brand new. But if it's yellow, which is just hyaluronic acid, which is a lubricant, then you probably didn't tear that meniscus when you heard that pop. And probably what happened, and this is so common, is the patella, the round bone in the front of the knee, dislodges from the trochlear groove in the femur. It's a little area where it slides back and forth. So when this guy went to the orthopedic surgeon and they found a meniscal tear, they said, you need surgery. And I looked at it and I said, what the surgeon is looking at is not the cause of the pain. It's not related to it. And we took out the fluid. It was yellow. It was hyaluronic acid, a lubricant. It wasn't blood. If it were a tear that happened, or an ACL tear, meniscal tear, something like that, it would bleed a little bit, or a lot of bit. I get a lot of people that come in with fresh ACL tears, and the first thing we do is we take out the blood, because if that clots up, it's a very slow healing. Also, if you have an ACL tear, do not get a surgery right away if you're going to have one, because most of those heal up on their own. The only reason you need a surgery for a torn ACL is if the knee is loose. And that's something the doctor has to take a look at to decide. Nita, I've been yakking a lot, and I know that you have stuff to say.
I
so-
know. I was thinking, oh my gosh, you must have had 6 donuts for breakfast. You're so
No, I don't.
energetic today.
I'm actually very ketogenic. I'm on a
I
weight
know, I'm
loss
teasing.
program.
I know you're ketogenic.
I'm trying to be as skinny as I can.
I am ketogenic. You taught me this like 20 years ago to be ketogenic, but we didn't call it that then.
No, what did we call it? The Paleolithic diet.
Yes,
back
it was
then.
paleo, but you always just said, when you go into the store, just think protein, vegetables, water. And I've been following that forever.
Yeah, and it's nice to be thin. I mean, I'd say probably 3/4 of my patients come in overweight, and then they're complaining about arthritis in their knee. Well, they're causing it. Studies show if you're overweight, every extra pound is like 4 to 5 pounds of pressure on the knee. So you're causing your own arthritis if you're overweight and you've got knee problems. Sorry, hate to be the messenger. Don't kill me.
Well,
So Nita, I'm gonna go ahead and until we get callers, I'm gonna tease you a little bit.
okay, but give the phone number again.
One more time.
Okay.
866-870-5752. Also, please go to my website, www.lastemcells.com. www.lastemcells.com. Every page has a spot to email me. I get emails all day and all night from all around the world, and I answer all of them. I like to talk to you live now, but if you're shy, I hope you're not, because we love our callers.
But the other reason to call is because they get your latest book for free, which is Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies. So if you're hearing this information for the first time and you're just kind of not quite getting it, you want to get this book and you want to share it with your family and friends because it's phenomenal.
You know what? It's amazing to me because I have so many people that heal, including me.
And me.
And you. Yeah, that's right. We did your neck years ago and it healed almost instantly. I've injected both my knees with stem cells, both my shoulders. I've done my elbows, my right wrist. Other people have done my neck and back because I can't see. Actually, I did my back, my low back one time by myself because I couldn't find a buddy anywhere nearby at the time. But usually what we do is when we go to national meetings, all the regenerative medicine docs, we inject each other. And we use each other as the example for the new guys.
As pin
learning.
cushions.
Well, you could call it that, but I'll tell you something. I would rather get injected and walk out than have a surgery and have a chance of infection and all kinds of terrible things that go on. I've seen people die on the table. Yes, I have. I'm not making that up. And I get people that come in all the time that go, some people are crying, why did I get that surgery? The surgeon said I'm going to be better, and look at me. I'm worse. I can't walk, blah, blah, blah. A lot of people end up in the hospital with infections. I had a patient years ago that had a hip replacement, and he called, and I told him, don't do it. You don't need it. We can fix it. He didn't listen. And he called me from the hospital 2 years after his hip replacement with an infection. Sometimes we get these insidious infections that don't really pop up for a long time. When it goes into the bone has all of these canals in it that germs, bacteria, virus, whatever, can get into, and they just kind of live in there very quietly. And when you get an osteomyelitis, that's a bone infection. That's typically a lifelong problem. You can take antibiotics, usually it has to be IV in order to penetrate the tissue very well, and you can quiet it down, and then maybe for a couple of years it's quiet, and then it can just rage again. So, I'm going to say it again. I'm not the guy who likes to see people have surgeries. Most often after a bad surgery, I ask the patient, did your surgeon ever examine you? And the answer is very rare that it's yes. It's typically no. They showed me the MRI or the X-ray and where I had to have the surgery. And to me, that's not a very good way to decide if a person needs surgery. So what else do I want to talk about? We do the vampire facelift in the office, which is very similar to what I do with the body in terms of stimulating new tissue to grow, but it's done in the face to regrow collagen in the face and to make people who are getting a little older where the collagen is drying up to make people look good again. It works really great. It's a cosmetic procedure that my wife does, and I don't do that. I just do the musculoskeletal system. And also we do hair stimulation by using platelets or stem cells on the top of the head. That's something that people love quite a bit. We do quite a bit of that. Anything else I'm not talking about, Nita, that I'm forgetting?
You could give the phone number again, and you can also let people know, please call and get the free book. Very important.
Okay, I'm gonna do something else. I'm gonna torture you for a second. Do you
Oh,
mind?
I love this part.
Okay.
Yes.
Until we get callers, I'm gonna put Nita on the hot seat. So Nita, why do you smear peanut butter on the road?
To give it a covering
Nita,
for
come
jelly
on.
to fly
Nita,
onto
you're
it.
so much smarter than that. I know you went to Harvard. So why do you smear peanut butter on the road, Nita? To go with the traffic jam.
Oh, my God. That's a good one. That's a good one.
Yeah, but you're not laughing. When you don't laugh, you get another one.
Okay.
What does a house wear?
A house wears a cover for termite protection.
Nita, no, that's not funny. What does a house wear? A dress. Address.
Oh, a dress. Of course.
Do you want to know why you can't hear a pterodactyl go to the bathroom?
I don't know if I want to hear this.
Because the P is silent.
Oh.
All right, now I'm going to take some questions.
Okay.
We're going to jazz up the show. Here we got a caller coming in, but until then.
Okay,
I'm
do a
not
quick
gonna-
question.
Yeah, we'll do a quick question. Well, I don't know if there is such a thing, but we can look for a question here. Where's a question? Let's see here. Come on, Marc Darrow, Dr. Darrow.
You haven't asked me to say my favorite word lately.
Oh, enthesopathy.
Very good.
Do you
Very
love that
good.
word?
I love that word.
All right,
I even
so
know what it means. It means the attachment of a bone to a ligament or a tendon.
you're absolutely correct, but we say it the opposite way. We say more of the attachment of muscle, tendon, or ligament to the bone.
Oh, why is that?
Because the bone is sort of like a bigger thing and the tendon's attached to them.
Oh, I see. So it's like a chicken egg thing.
Kind of, yes. There's tons and tons of ligaments, tendons, and muscles that attach to the bone,
Okay.
but it could be just one bone that's attaching all of those. So that's just the way we say it.
Okay. So did you
But-
find a question?
Well, I want to talk about enthesopathy first,
Oh,
since you
okay.
brought it up.
Okay.
Areas we find enthesopathies all over the body. And low back, for an example. Let's say someone comes in with a herniated disc, and I examine the low back, and I press right above the pelvis, and they jump. We call that the jump sign. It means that's the place the pain is being generated from. That is most likely an enthesopathy, where several things attach to the pelvis in the back. It's nothing to do with the herniated disc they have, okay? It's nothing to do that needs surgery. It's very simple. It's a sprain. It's like a sprained ankle. Do sprained ankles get surgery?
No.
Why do backs get surgery? It's very sexy. Very sexy to have back pain. There's all kinds of nerves around there that surgeons think need to be decompressed. Most of the time it's not true. So in the low back we have the iliolumbar ligaments. You can type that into Google, and in the upper left-hand corner there's a spot that says images. Click on it and you will see pictures or videos of the anatomy. Also at that spot in the low back is called the thoracodorsofascia, and that you can look at also. It's like a saran wrap that covers the muscles in the back and attaches on the pelvis. Another thing down there is the quadratus lumborum muscle. It originates on the lower ribs and inserts on the pelvis. There's a lot of action down there. So most of the back pain that I see is from that type of an enthesopathy. Enthesis is that attachment. Pathy means disease. It's not the kind of disease like cancer. It's a musculoskeletal issue. So that's what an enthesopathy is, Nita. You said the right word. I'm going to go
See, I have learned something in 13 years of hosting the show.
13 years, Nita, my God.
We're in our 13th year. Doesn't time fly when you're having fun?
I am having a blast. I love my work. I absolutely love this more than anything I do other than my family. I do like golf and sports, but there's not a day that I wake up that I cannot wait to go in and see my patients. I had a morning the other day, a few days ago. Every single patient was healed that I'd injected. And I was like, how are my twins going to get to finish law school if you heal so quick? I was teasing everybody. All right, so this one says, stem cells for hypermobility. Does anyone do stem cell treatments for Ehlers-Danlos syndrome? And is it successful? Yes, yes, and yes. I do it all the time. That's a syndrome with a collagen issue where it becomes lax. People that have that can bend their wrists kind of backwards so their fingers touch their arm or bend it forwards. Their knees, typically, when they stand up, the leg bone will go out to the side a little bit. And it can be a situation for pain generation, and we get very, very good success with it using platelets and or stem cells, PRP and or stem cells, which thickens up the tissue. Wherever we inject these cells, it thickens up the tissue and tightens it up. So that's a syndrome we can help quite a bit. And very often I'll find people that have dislocating shoulders because of that syndrome, and we tighten that up. Usually takes like 2 or 3 treatments. We are going to Milan. He is doing great. I gave him injections. Milan, tell me what's going on. Dr. Marc Darrow, thank you for calling.
Hi, Milan. Are you with us?
Scream louder. I can't hear it. There you go. Milan, tell us what's going on.
Can you hear me?
Yes, now.
Now we can, yeah.
Okay, you're coming in kind of sparsely, but I wanted to call you and let you know that we're progressing with stem cell.
Okay. And what part of your body have I injected?
Rotator cuff. Totally screwed up.
Okay. And how long have you had pain in your rotator cuff?
Both shoulders actually, but you only treated me on one.
Okay.
And you gave me 2 injections.
Okay.
And I switched insurance and went to Kaiser. And says, well, they said we don't do stem cell. I said, well, let me tell you something. You've done some in the past, and but they have to be critical. And I said, well, they want to take my rotator cuff off. Is that critical enough? So anyway,
that's pretty wild.
I said, treat, not operate. Well, anyway, so what I'm trying to tell you is they're going to give me an injection Monday.
The injection you're going to get Monday, don't do. Hang with us, Milan. Hang with us. We're going to the break. Anybody that wants to talk to me live right now, 866-870-5800. 5752. And if you want to look at the website and email me through that, that's www.lastemcells.com.
Okay, you're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens. We'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.